Have you ever wondered if all memory problems are the same, or if there is a difference between various types of dementia? It is a common question and a really important one, because understanding the specifics can make a huge difference in how we approach care and support. No, vascular dementia and Alzheimer's disease are not the same. While both conditions involve cognitive decline and are forms of dementia, they have distinct underlying causes, specific symptoms, and different ways they affect the brain. Thinking of them as separate conditions is key to accurate diagnosis and effective management. The core difference lies in what causes the damage in the brain. Alzheimer's disease is primarily caused by the abnormal buildup of certain proteins in the brain, namely beta-amyloid plaques and tau tangles. These proteins disrupt brain cell communication and eventually lead to their death, particularly in areas important for memory and thinking. Vascular dementia, on the other hand, is caused by damage to the blood vessels that supply blood to the brain. This damage can result from strokes, often called mini-strokes or transient ischemic attacks, or other conditions that reduce blood flow, depriving brain cells of vital oxygen and nutrients. Knowing this distinction helps health care professionals pinpoint the exact nature of the cognitive changes. For Alzheimer's, the onset is often gradual, starting with memory loss and slowly progressing to other cognitive functions. With vascular dementia, the changes can sometimes appear more suddenly after a stroke, or they might progress in a stepwise pattern, meaning periods of stable function followed by sudden declines. Understanding these patterns is critical for families and caregivers as well. A fascinating detail about vascular dementia is that it is often associated with conditions like high blood pressure, high cholesterol, and diabetes, which are risk factors for heart disease and stroke. Managing these underlying health issues can sometimes help slow the progression of vascular dementia. For Alzheimer's, while there are risk factors like genetics and age, the primary focus is on understanding the protein pathologies. Sometimes, a person can even experience a mix of both conditions, known as mixed dementia, which makes diagnosis even more complex and highlights why expert medical evaluation is so vital. So, while both conditions impact memory and thinking, they are like two different paths leading to a similar outcome, each with its unique terrain and challenges. Recognizing that vascular dementia stems from blood flow issues and Alzheimer's from protein buildup allows for more targeted strategies, whether it is managing cardiovascular health to prevent further damage or exploring treatments that address protein pathologies. This deeper understanding empowers us all to navigate the complexities of cognitive health with greater clarity and purpose.